Child Mental Health Nursing. Unit 1, Module 4, Building Resilience, Attachment, Early Relationships, and Developmental Mental Health. In the last module, we examined how stress impacts the developing brain. Now we ask a critical question. What protects the brain from stress? The answer is not just the absence of adversity, it is the presence of protective relationships. Resilience is not a personality trait. It is a biological process. It is the brain's ability to return to baseline after stress, and it is built through repeated experiences of safety, connection, and support. The strongest protective factor in childhood is at least one stable, caring adult. This adult provides emotional attunement, predictability, co-regulation, and repair after distress. This buffering relationship turns off the stress response repeatedly. Children do not start with self-regulation, they borrow it. When an adult remains calm during a child's distress, the child's nervous system begins to settle. Over time, these repeated experiences build internal regulation. Self-regulation develops from co-regulation. Resilience also grows when children experience small successes, problem-solving, safe independence, and a sense of belonging. These experiences build, I can do hard things, I am safe, I matter. Mental health begins in infancy. Infants and toddlers express distress differently than older children. They may not have words, so they communicate through behavior, development, and interaction. The quality of early relationships shapes emotional and neurological development. Some of the earliest signs of mental health distress are developmental. In psychosocial failure to thrive, a child may show poor weight gain without medical cause, limited eye contact, flat or withdrawn affect, and delayed development. This is not just a feeding issue, it is a relational issue. The child is not receiving consistent emotional attunement, and without that connection, development is disrupted. Children experience grief differently than adults. They often do not verbalize loss. Instead, grief may appear as regression, irritability, separation, anxiety, and behavioral changes. Young children may repeatedly ask when a loved one is returning. This is not denial. It is developmental processing. They may lose previously acquired developmental skills. This is regression. A child who was sleeping independently may begin waking frequently. A potty-trained child may begin having accidents. A verbally expressive child may become quieter. A child that was physically active may stop engaging in skills they recently mastered. For example, a toddler who recently learned to scoot or walk may temporarily stop using that skill. This is not a loss of ability, it is a stress response. The child's nervous system is overwhelmed and shifts energy from development to survival. Regression is the brain's way of seeking safety. A 2-year-old presents with poor weight gain and limited engagement. The caregiver reports high stress and difficulty bonding. Recognize cues, poor growth, and limited interaction. Analyze cues, possible psychosocial failure to thrive. Prioritize, assess caregiver-child relationship. Generate solutions. Support the caregiver. Refer early for intervention. Work with caregiver to strengthen attachment. Take action. Provide guidance on responsive interaction. Evaluate, monitor growth and developmental progress. Resilience is built, not inherited. It develops through relationships. When nurses support caregivers, strengthen attachment, and recognize early signs of distress, we are not just supporting the child. We are shaping lifelong mental health.